God, thank you for the opportunity to meet together. Please help us to come together to make this institution reflect your kingdom. Breathe life into our ideas and decisions. Help us build a team that has love and respect at its heart. Give us the strength to continue working for your kingdom in this time of pandemic. Lord, come give us the inspiration to be the best we can be. May we be a shining example of your goodness and truth within, wherever we are. Inspire our thoughts, discussions, and ideas, and continue to remind us that all that we do here today, all that we accomplish, is for the pursuit of truth for the greater glory of you. We ask these things in your name. Amen.
Like na po to introduce to everybody, of course, is a physician po, a nurse, a pharmacy, botany, aesthetic, dermatosurgery, an anti-aging practitioner, academician, consultant strategist, and an entrepreneur, no other than Dr. James Boado. Palakpakan po natin.
Okay, thank you, Miss Kay. And am I coming to you clear?
Yes,
Clear po ba? Okay, sige. Okay, so magandang hapon, magandang hapon na. Good afternoon to everyone. And medyo maulan dito sa aming lugar. And well, of course, sabi ko nga, sana nga, pag usually this particular time of the day, medyo umaagaw ng ng inyong siesta time or inyong pagtulog, no? Pero of course, you want to learn more, and then of course we're going to give you that. So instead of you having your siesta or your sleep or nap time, you are here very interested to learn more about our product. Yung sinabi nga ni Ma'am Kay na star product, yes, definitely for the moment, no, medyo talagang star ang ating ALTAIMUNE because it really is helping a lot, no? Helping a lot of people in preventing diseases, no? And then of course, if I may just share, so even before I could be doing my lecture, just to inform you that this has really helped me, okay, and my family in these very trying times. Now, let me just state that, my mom is positive after she acquired, it from my sister who also turned positive. So, well, she was just trying amongst my siblings, or in the family, yung sister ko lang po ang walang vaccine. So I tried to just have her because she has a lot of allergies. So medyo talagang we're trying to get the best for her that would suit her. Pero of course, nagkaroon po ng chance kasi several times na po siya that, we've been trying to get, from different areas or locations or local government, no? So until ito nga po, she was given the chance to have the vaccine, but because ang dami-dami po ng tao, no, so medyo natakot po siya sa kanyang pagpasok doon sa gate, so hindi po siya nagtuloy, though she was able to acquire the virus already and not really knowing that, she is already afflicted, no, so she is a carrier. She stayed with my mom. So, and then of course, my mom is already vaccinated. So she had AstraZeneca 2 doses. But of course, hindi siya aware that, of course, that, my sister had the virus since non-vaccinated. So after she left our place, medyo few days, she developed some sore throat. And then of course, sabi ko, magpa-swab. And then of course, ang problema nga lang niya was really to go for a swab that, syempre medyo malayo po, mahaba po ang mga pila ng pagpapaswab. So but then of course, I tried my way to inch to having her swab and turned out positive. The day after that, she turned positive. My mom also turned having some cough and sore throat. So, oh no, sabi ko ganon. But, of course, my mom, constantly naman she's taking also ALTAIMUNE. But of course, at that height and that parent time na of course that she had it kasi they were in one room constantly, yung sister ko. So talagang she had really a full-blown viral affliction or parang acquisition. So she developed it. Now, okay, she's on her 10th day. So basically, well, she's geriatric, no, medyo old age. So medyo ang ano lang namin, ang concern lang namin is the cough that medyo is kinda um, medyo, well, sporadic naman. Hindi naman siya ganun kapanay-panay. But then of course, constantly it's medyo sticky. But then of course, with the help of the ALTAIMUNE, medyo we are almost in the recovery period. My sister also had ALTAIMUNE. She never had vaccine, so hindi pa rin siya nagba-vaccinate po. But then of course, only just ALTAIMUNE and plus of course some other supplements that I have given her. And well, sadly that my sister's daughter get also affected, so she acquired COVID also. And then of course, mas marami ngayon na pediatric cases na nagkakaroon po ng variants or ng COVID. So please do extra care. And then of course, at the height of it all also, medyo ako nakaramdam din po ng symptoma, although vaccinated ako, AstraZeneca. And then of course, I don't know if it's stress or fatigue that made me feel also some of the symptoms. I had a sore throat and nag-ano po ako, what's this? Wala namang coughing, walang fever, but then that night po, medyo masakit po yung ulo. It's not really that throbbing, but of course, it's persistent. So all I'm saying is, kahit naman po vaccinated, you can still be acquiring it. Especially nowadays that mas marami ng variants ang lumalabas. So I'm telling you that even if we have this ALTAIMUNE, that we are actually being protected or prevented. But then of course, it's important that we have to have our vaccine para po hindi po maging severe. I had to have my swab the following day since I wasn't able to sleep, no? But then of course, this is not I don't know if I will, well, of course, I have to tell you what I actually did, no, that night. So normally, we would have to drop it, okay, 1 ml every hour. But because I actually felt that I need to actually be doing it, so I had to divide one bottle into, that's 50 ml po, no? I divided it into 3 intake lang po. So parang I had it like 1 tablespoon. So that's 15 to 18 ml. So 3 times that night. But I was really relieved by it. Okay. And then of course, when I had the swab, so after 12 hours, the result came in. And then of course, it says it's negative. Though I know that I am symptomatic. So at the onset of it, at the start of it, so it's important that no, hindi po ipapagsawalang bahala natin yung mga simptoma. Kahit sipon, ubo, or pangangati ng lalamunan, kailangan po bigyan niyo po siya ng pansin. It's not because, kaya yan ng aking sistema. Yes, kakayanin. But of course, kailangan po ng suporta. And then one of the support will be like ALTAIMUNE and then of course, vaccination. And of course, preventive po measures all the time. Yan po yung mga ating mga sinasabi na, okay, so face mask and shield, social distancing, then of course, washing of your hands. And then of course, if you don't need to be going out, don't have to go out, please. Iba po ang panahon, mas matindi po ang mga variants, and then of course marami po ay kinakapitan kahit po meron tayong itong mga preventive measures. Okay, so that is just reminder. So kahit araw-arahin po natin itong lecture natin, if you're not going to make use of what is available for all of us and for our members in the family, well, of course, I don't want you to regret later on, but of course, syempre, kailangan po natin pong labanan lahat ng ito until such a time when we are all vaccinated, and at the same time, we are all preventive in all our in every single step of it. Okay, so let me just now share my screen. So good afternoon once again. So I have here my lecture. Constantly been doing this lecture for some time already, and of course I know for some of you have been well, of course, some of you are constantly attending and listening to the lecture. It's the constancy, no, medyo of like, okay, parang constantly that you're hearing it and then it gets imbibed into your system, no? Maganda po yun. And then, of course, you can easily talk about it even with your eyes closed. Now, okay, so for those who are first-timers, of course, you can always just ask questions. You may, if you may need to clarify something, then you can actually put that in the chat box later on so that we can actually answer all your questions or your inquiries. Okay, so let's get started. Okay, so my topic is preventive therapy with essential oil blends having antiviral, anti-inflammatory, and immunomodulatory properties. So let me just begin by dissecting the title, no? Preventive therapy. So preventive is even before, no, magkaroon tayo ng mga disease or illness, wala pa tayong sakit. Preventive na tayo. So as the name implies, prevention. Okay? So using the essential oil blends. Okay? And then of course, later on, you will know the active ingredients of this particular blends, and then of course, and the properties that it contains, no, antiviral. So it's very apt to be talking about SARS-CoV-2, knowing that it's a virus. No, it's not just the SARS-CoV-2 that we're going to be encompassing or talking here. So napapanahon lang po na SARS-CoV-2 ang ating example because it's appropriate to be talking about it. Anti-inflammatory, so lahat ng mga inflammations ng ating system, okay? So, and then of course, immune system or immunomodulatory properties. So ano po ang nagagawa nito? Okay, so let me just share to you that there are more viruses than stars in the universe. Like even if you look on top of sa mga clouds at night, okay, you can never even count the stars. And then the viruses are even more than that. They're a quadrillion viruses, and they're estimated to be a 10 nonillion, okay? Individual viruses that can actually be, pwede mo i-assign yan sa lahat ng mga stars pero kulang pa. So they're actually tenfold, okay, 10 nonillion viruses that are available. Okay, they can infiltrate every aspect of our natural world. So kahit saan pong parte ng mundo natin ay meron pong mga viruses. So they are generally considered non-living. So bakit ganun? Bakit sila nakakapaminsala? They're non-living because they are actually able to propagate within the cell. So paano po makakapropagate or reproduce inside the cell? So it has to attack, okay, all our cells, the human cells, the animal cells, and the plant cells. Okay, depende sa klase ng virus. Okay, until they can actually be invading all our cells, and then later on, then we can have the disease or the illness or the infection. Okay, so this is how it looks, okay, a SARS-CoV-2 structure. No, they seem to be very beautiful, no, but then they are also catastrophic or they're very lethal, no? So in terms of its affectation, in terms of its manifestations of symptoms and signs, okay, so medyo mapaminsala po siya. So it has, okay, a lot of structures that you would look at it. If you would look at it rather, this is a lateral section or a cross section rather of SARS-CoV-2. You have here at the outside of the envelope is the corona, no? Kaya nga po coronavirus. These are what we call as the spikes, okay, that are attached to the envelope. So spikes. Okay, what is this spike for? It's needed for its attachment, no, sa ating mga cells. So kumbaga sa pinto, sa receptor site, meron tayong doorknob. sa pinto. So ito po ang i-attach ng virus, yung kanyang spike sa doorknob para makapasok sa pinto or sa ating cells or sa loob ng bahay. It has the envelope, it has also the membrane, and inside the structure is a nucleocapsid that has the genetic material known as the RNA. Okay? So yan po yung struktura ng ating SARS-CoV-2. Ang lahat ng mga viruses ay halos ganyan ang mga itsura, no? Depende sa kanilang mga pamilya or classification. Okay? Now let's get into the depths of it. Okay? So ano ba yung tinatawag na agent? Okay, so ang triad po ng ating epidemiological triad of infection ay may 30 components. Okay, so yung agent, meron pong environment at at yung pangatlo yung host. Okay, yung host po tayo yon. Yung host, yung human cells, animal cells, and plant cells. Ang tawag po sa atin host. Ang agent, okay, it's the one that's causing the disease. It's a microbe that is too small to be seen by the naked eye. So very, very small that you cannot see it. Even with your eyes wide open, hindi natin po makikita yan. It has to have an electron microscope. It's really submicroscopic before you can even see that. You can even see it in the face mask, no, or in your handkerchief. No, hindi po yan nakikita. So it's so minute, it's nano in size. Okay, it's nanometers. So it's the one that's causing the disease, and it could be classified as either bacteria, virus, fungi, parasite, protozoa. But since, of course, it's very apt to be talking about virus, we also have to be comparing it with also the one that's causing us a lot of infection, yung bacteria. So magkaiba po ang bacteria, magkaiba po ang virus. Okay? So it's the one that causes us the infection. So agent, ano po ba ang, okay, let's talk about bacteria. So ang bacteria ay single-celled organism. It has its own tool for reproduction. They can actually reproduce by themselves even without having, okay, the host cell. Hindi kailangan pumasok sa cell ng tao para mag-reproduce, okay? So the bacteria, compared to the virus, they're larger, but they still are not seen by the naked eye. So they're also small to be seen by the naked eye. Pero mas malaking di hamak ang bacteria. So they are filled with fluid and thread-like structure to move about, and we call this as the tail or the flagellum. Okay, just to give a better picture of what a bacteria would look like. Okay, so this is how a prototype of bacteria would look like. Okay, now here you have the pilus. It's a very small structure. It's used for its attachment. No, kung sa viruses may spike, sa bacteria may pilus. Okay, and then also we mentioned about the flagellum, which is the tail that makes it actually move from place to place. Okay, so try to notice that the structure of the encapsulation or the covering of a bacterium. Okay, so usually it has a capsule. No, sa labas ng ito yung pinakalabas, okay? And then you have, okay, the middle layer, which is the cell wall, and then you have your plasma membrane inside the cell, okay? And then, of course, or inside the cellular, inside the cell of the bacterium. But then, of course, inside you have the nucleoid material. This time, it's the DNA. Kung sa viruses, RNA, okay? So bacteria, DNA, okay? So another one is the virus. They have spiny structures called the spikes. Okay, they have a core genetic material that actually reproduce, no way to produce on its own. So they need to infect the human host cell. So these are some of the viruses that we have actually captured submicroscopically or using electron microscope. They seem to be very beautiful, but they are all devastating. Okay, so catastrophic or lethal. Okay, so you may have heard of HIV. So this is the structure: hepatitis B, Ebola-virus, adenovirus, influenza, rabies, bacteriophage, and all so on and so forth. So these are all some of the viruses that has infected or afflicted human beings. Okay, so as mentioned, you have the spike in this structure. This is another representation of a virus. And just to show that, you know, you have a glycoprotein that makes it actually attached to the receptors or to the doorknob, say, for example, in an analogy, no? Okay, so, and then of course, this is our cell, okay? This is our human cell with all the organellar structure inside the body. So once this is affected, okay, it can actually cause this to die, no? So pwedeng patayin at mag-reproduce after it has reproduced inside the cell, then this could actually be pwedeng yang patayin later on, and then it could actually be transferring to another cell and then causing you devastation or for devastation or the illness within few hours only, no? So ganun po kabagsik ang mga viruses, especially with the variants now, so mas malaki ang pamiminsala nila. Okay, so for us to be infected, it has to have a portal of entry of all these bacteria or viruses. Normally, or most common portal of entry is through the nostril or the respiratory tract. Okay, so sa nares ng ating mga ilong papasok, pag nasinghot mo, may bumahing, may umubo, may nagsalita, no? And then of course, hindi na nga ngayon. And then of course, ang sabi nila, it's already airborne. So even if like, okay, nobody's sneezing, nobody's coughing or talking, okay, some of it are left in the air. So it's important that we don't remove our face mask and also our face shields, okay? So once it is centered, definitely it will go into the nasopharynx. This is the nasopharynx area. And then, of course, this goes down to the oropharynx, okay? And then it may later on go down to the pipe, going into the larynx and the trachea and going into our lungs. Okay, that's the portal of entry and the entry into the respiratory tract. Okay, so the SARS-CoV-2 detection rate was significantly higher for the nasopharynx. So nasopharynx po, yung sa pinaka-taas kesa sa oropharynx or sa bunganga or sa bibig rather. Okay, so 46.7% or about 56 over 120 ang nakakapasok or mas malaking yield ang ng viruses doon sa nasopharynx. Okay, the sensitivity sa between nasopharynx and oropharynx is higher for the nasopharynx than the oropharynx, meaning mas marami pong pag kinuha o nag-swab sa nasopharynx, mas malaki po ang sensitivity doon na meron pong virus kaysa sa oropharynx. Okay, and it's just actually it's the one that is being used for both the symptomatic and asymptomatic cases of SARS-CoV-2. Okay, so both the symptomatic patients, okay, they have a very high yield of viral load sa nasopharynx than sa oral or sa throat, okay? So it's the same also distribution that was observed for asymptomatic. So both symptomatic, meron mga simptoma, or asymptomatic, walang simptoma, pag sinwab, mas mataas po ang sa nasopharynx, okay? Now, let's talk about time incubation period. It's important that you have to note of this kasi bigla ang nakapag-usap ka sa isang kaibigan, then of course, then you are also exposed. Hindi mo alam kung meron siyang sakit. You have to note of that time or the incubation period. It's when you were actually infected and when the disease symptoms occur. So usually 2 to 5 days after you got exposed, no, and then you get also signs and symptoms. That's the time that you were actually incubating the disease already. So 2 to 5 days, meron kang fever, say for example, or pangangatay ng lalamunan, or yung inyong bahing. Pag bahing ka ng bahing, okay, pwede din po yun. Sabi nila, okay, hindi daw po kagaya ng usual na basang sipon or basang bahing, no? Okay, or dry daw usually, but then of course not this time, hindi na. Sometimes you can have it concomitantly with, okay, those who were having some allergy or allergic rhinitis, no po, pwede po magkasabay yan. Okay, so then you have to note of the time when you got the symptom. And also it's the duration of the illness or the amount the time person can be sick before actually becoming recovering or pwedeng ikamatay. So yan po yung tinatawag na incubation period. Okay? Also the term pandemic. So it's the disease outbreak and it spreads across countries, no? Hindi lang sa mga bansa, pwede din sa mga kontinente, no? Okay? And more people and are affected and more lives are afflicted when we say pandemic as compared to epidemic, no? So illness is severe and spreads quickly. Mas mabilis, mas malaki ang magnitude or yung involvement ng mga tao. It's not the first time we're talking about pandemics, okay? So we've had, okay, notable pandemics in the past, okay? So just to mention some of this, okay, we have the Black Death in Europe. So this happened in 1347 to 1351 with 25 million death, no? In a span of like how many years, no? 3 years po, no? Medyo 25 million ang namatay. So we're actually almost just at 1.5 years since the pandemic started in the Philippines, no? Or rather the epidemic, and then it actually had the pandemic involvement, no? So sa atin ngayon po ay parang nasa 4.4 million global yung death natin. So as compared to 25 million in 1347, notable which is the Black Death, no? Ito po. And then of course we had another which actually came in during the 20th century, and this we know as the smallpox, okay? Smallpox, and then it caused 300 million deaths. So this is so massive. So now 4.4 is far from 300. Of course, we just don't want it to escalate some more. And then we just hope and pray that it stopped. But then, of course, during 20th century, 300 million is a big or a very huge number. Okay. So influenza or Spanish flu that happened in 1918 to 1919, it caused around 15 million deaths. And thereafter, it had recurrences in 1957, 1968, and 2009, with several deaths also occurring. And then, of course, one that is actually continuously increasing in number and counting, no? So medyo dumadami po ang ating kaso ng HIV/AIDS. Okay, at 32 million deaths and still is increasing. So wala pa po tayong empiric drug for the HIV, so it still is being studied. Okay. It's also important to be talking about the immune system. Okay, so when we definitely are actually talking about all these mga pandemics, infections, illnesses, and all that, it's important that we also tackle the immune system. So when we talk about the immune system, just like other systems in the body, digestive tract, respiratory tract, or cardio, and all that, so it is another system that is actually important to be talking about. It's a network of cells and proteins. So that defends our body against the infection. So kung wala kang defense, of course, definitely all the infections will come in. Microbes, lahat ng bacteria, viruses can get into your system. So ang immune system din po ang nagre-record ng every germ that comes in. Okay, if you've had it in the past and if later on bumalik siya, okay, may record na siya and easily can combat it. Okay, so that's why when we had viruses, okay, so pag sinabi na, okay, that you had it, you attacked me before, hindi ka na pwedeng bumalik dito at mag-attack ulit. So meron pong memory na tinatawag ang ating immune system to prevent further recurrences, okay, or infections. And then abnormalities of the immune system can actually lead into allergic diseases. Okay, so you may mga allergic diseases, it only shows that your immune system is really way down low, or it's actually under function, or it's not functioning well. Okay, Also, you can have immunodeficiencies and autoimmune disorders that are actually abnormalities of your immune system. So, well, of course, under the immune system, we have the WBCs. It's the key player in actually in combating all the bacteria or the viruses or any infection that would come into our body. So, ito po ay pinuproduce sa ating bone marrow. So if you have problems with your bone marrow, definitely you might not have a very good defensive WBCs that will be produced out there. Okay, so they look for foreign body invaders and launch an attack. So ikaw ay foreign body like okay, viruses, bacteria, foreign body yan dahil hindi yan talaga nasa katawan natin. So pag pumasok sila, ia-attack ng WBC. So ang klase ng mga WBC includes your B cells, T cells, and natural killer cells. Okay? And then of course, we have the term antibodies. So ito po ay importante to fight the microbes or the toxins that they produce. So kasi ang mga mikrobyo, bacteria or viruses, magpo-produce po yan ng toxin para pinsalain ang ating mga cells. So, okay? So but these antibodies are the ones that actually combat or try to eradicate these toxins. Okay? And then of course, usually ang antibodies na produce siya after you've had an infection, say for example. So kaya po tinitingnan natin yung mga antibody titers, yung immunoglobulin G or immunoglobulin M. Kung meron kang past infection, IgG is high. Kung meron kang acute or recent na infection, you have IgM that is high. Okay? So, lymphatic system. Ito po ang sistema or network of delicate tubes throughout the body. So, ito po yung dinadaluyan ng lahat ng mga lymph fluids, yung infections, yung mga microbes, okay, until it will be filtered into our mga lymph nodes. No? Yung mga pag kinakapa, kapag may infection ka sa ulo, dito sa neck, titignan niyo kung merong inflammation or pamamaga ng mga kulani. No? And then, of course, that only shows you have infection kapag enlarge ang inyong mga lymph nodes. But otherwise, if you don't have an infection, wala kang makakapa ng mga lymph nodes. Okay? So, lymphatic system roles are the following. So, it manages the fluid levels in the body. If you have too much, okay, of fluids or if say you are congested, no, medyo ang role ng lymphatic is to drain the extra fluid or excess fluids in the body and then excrete it out of the system, no? And then they may also react to bacteria as an invader, so they'll try to make or to absorb or to actually drain the bacteria, or maybe also when you have cancer cells. Okay, so pag may cancer cells ka, of course, it will be drained through the lymphatic system and will be it can be palpable na po doon sa makulane. So ginagamit po natin yan pag stage ng ating mga cancer or stage ng cancer, no, or tumor. So pag halimbawa po kumalat po na sa kulane, okay, so yun may mga levels na tinatawag T1 and 1, mga ganun po, no? So sa lymph nodes, okay? And then also with the cell products that would result into disease or disorders, and also for some absorptions of fats at a certain level. It is made up of your lymph nodes. Ang sinabi ko nga yung kulani or lymph glands that traps the microbes, lahat ng mga viruses and bacteria, and then carries with it lymph, no? Yung parang fluid. It's a colorless fluid that bathes the body tissue and contains infection and WBC. Okay, it also contains WBCs or the lymphocytes. Okay, so this is how it looks. Okay, may look so intricate, and then of course, syempre kasama po sa lymphatic system is your tonsils. So it's not just there because parang okay, linagay lang siyang tonsils there. It is actually it actually plays an important role in actually draining some of the infections. So that's why when you have also tonsillitis, di ba po? So ibig sabihin, of course, it's trying to drain, but then it's actually overwhelmed. Kaya po, magang-maga, and then of course, that needs to have some antibiotic to be treating the infection, no? Or the inflammation. Also, yung thymus natin, yung lymph nodes dito sa mga kilikili, sa mga singit, and then of course, the lymphatic vessels na tinatawag, the liver is also part of our lymphatic system because it's actually what? Draining all this yung tinatawag ng enterohepatic circulation. So lahat po ng ininom, kinain, at lahat ng mga gamot po, lahat po ay halos lahat pag orally taken, it will have to be sieve through or parang it will be filtered by the liver. Okay, pero kung halimbawa mayroon pong fatty liver, so definitely there will be difficulty in filtering all these materials, no? And then of course, you have your spleen, okay, yung pale, okay, tama ba? O sige, I'm not so good in Tagalog po, pasensya na po. So, spleen, and then of course Peyer's patches, and then of course your these are all actually in your small intestine. And then of course your appendix is also a part of the lymphatic system, and then of course your bone marrow. Okay, so yan yung mga struktura ng ating lymphatic system. Okay, as mentioned, yung bone marrow is the one that produces your RBC or red blood cell. Ang importansya po ng red blood cell is for it to carry the oxygen. So pag may problema pong bone marrow, RBC will be decreased. So yung oxygen carrying capacity po ng ating katawan ay bababa. Ang WPC din po ay doon din po pinuproduce sa ating bone marrow. So pag nangyari po na may problema, okay, mababa din po ang WBC. So pag mababa ang WBC, wala pong pangdepensa ang ating katawan laban sa mga infections na viruses at bacteria. Ang platelets ay doon din po sa bone marrow. Okay, so pag bumaba po ang platelets natin, magkakaroon po tayo ng bleeding tendencies. So hindi po maaambat ang pagdurugo, medyo nakakatakot po, pwede po yung mag-shock at pwede kayong mamatay. Okay? So ito lang po ang just to show that, you know, when all these viruses could be afflicting human beings, it could also be going into the bone marrow and afflicts all the components that are necessary for us to be able to combat all the viruses and the bacteria. So since these are all laden with viruses, it's eating up all these structures there. Okay? So nakakatakot po. Hindi lang po ang respiratory tract ang nagiging cause ng infection or nagkakause ng problem doon sa ating SARS-CoV or ating COVID-19. It could also be the one in, it could also be affecting our bone marrow. Okay? So, another structure that I have actually failed to mention is the thymus. Okay? So, ang thymus po or thymus is actually the one that filters the blood component, and they produce also white blood cells. So, apart from the bone marrow, so WBC is also produced in the thymus, and they're called T lymphocytes. Okay. Apart from those mentioned, okay, there are other defenses or body defenses against microbes. Okay, we have the biggest structure in our body or the biggest organ that we call, it's the skin, no? So lahat po niyan, parang ilang metro po yan. Pag tinanggal mo yan sa ating katawan and then you measure, it's actually several meters. We have also the lungs that actually prevents the, well, of course, expectorates or expels the different microbes. Okay, digestive tract. Okay. And then, of course, body fluids, skin oil, saliva, and tears. These are all our defense mechanisms against, okay, or defense parts in our body. Okay. Fever may sound like, okay, it's negative, but then sometimes it's a sign, okay? So it's a symptom that, you know, most of us are actually looking for in when you have infection or any inflammation. So it's an immune system response. It tells you that there's something wrong going on, okay? Something is wrong. Okay, so a rise in the temperature could also be killing some of the microbes, and also this would trigger repair mechanisms in the body. So pagkatapos po ng fever, so there will be repair. Kumbaga, after the storm, there is always the repairing mechanism. Okay, so meron pong ganon. So what are the common disorders of our immune system? Sabi ko nga po, pwede po, pag may mga allergic diseases, you have a very weakened immune system. Okay, so then where do we get all these allergic diseases? So we may be getting it from our food, from our medications, and also sting bite from bee. No? And then, of course, you have an anaphylaxis, which is the dreaded type of allergic disease. No? Medyo ito po ay immediate. And then, of course, pwede pong ikamatay. So, anaphylactic shock ang tinatawag po natin. Then, we also have another allergic disease, which is an allergic rhinitis. Okay, comes constantly in the morning that you sneeze out every day. Then, due to some hay or pollen or dust. And then, of course, you can have this as a sign of an immune disorder, immune system disorder. Then, of course, you have sinusitis, some asthma, hives, dermatitis, eczema. So these are some of allergic diseases that are constant description of your immune system, meaning it's way down low. So if you have autoimmune disease, this is another disorder of your immune system. Your immune system mounts a response against a normal body component. No, so normal body part, but then of course the hormone, no, some of the chemicals there are trying to combat the body. No, so you can have this in multiple sclerosis, or when you have thyroid disease, Graves' disease, diabetes type 1, systemic lupus erythematosus, rheumatoid arthritis, systemic vasculitis. So these are more of mga, um, these are all autoimmune in nature. So immunodeficient, when we say immune system deficient or underactive, sometimes you get this through genes, through your genes, or it could be inherited, and or maybe it could be as a result of a medical treatment. So those who are actually constantly having um, chronic medications, okay, medical treatment, okay, you can actually run into immunodeficiency and make you immunocompromised later on. Or it could be a cause of another disease. So say, for example, end-stage renal disease, okay, mga ganyan, then you can have that as an immunodeficiency. Now, there are 6 signs that you are actually on a very weakened immune system. So when you are well, your stress level is so sky high, sky high, that you don't even know if you can function anymore or still can function. Meaning, sobra kang stress na hindi mo na alam kung ano ang gagawin mo, that of course it also affects your dynamics, no? And then you always have a cold, no? So may sipon, no? And then of course that actually doesn't really or usually last for a long time. Lots of tummy troubles. You may be gassy, or you may have some bouts of diarrhea. So since you're stressed, usually you have the stress diarrhea. And then sometimes you may have constipation or not being able to remove the bowel. Okay, so but of course, you just have to rule this out if you have also some cancer. Okay, if you have a wound that slows to heal. So meron mga sugat na medyo normally, alam mo naman dapat na medyo mabilis lang ang closure ng iyong mga sugat. But then of course, if it's longer than a week or say more than 2 weeks, then of course it still is open and fresh, then you are actually having some immune system problem. And have to rule this out if whether you have diabetes mellitus type 2 or type 1. Okay, you have a frequent infection. Okay, lahat ng mga sinusitis, laryngitis, bronchitis, lahat ng mga itis. Okay, these are actually signs that you have a very weak immune system and you feel tired all the time. So even upon awakening, no, so parang nakatulog ka naman kahit papaano, or minsan hindi ka nakapagtulog na maganda, no? And then of course you feel so weak and then tired, no? Then of course you have a very weak immune system. So how do you boost this immune system? So definitely balanced diet. Okay, so balance is when you have to have your carbohydrates, fats, and proteins, and then of course include your fiber. Okay, so getting enough sleep. Okay, 6 to 8 hours per day. And then, of course, exercising regularly. Okay, so nowadays, ang hirap mag-exercise because now we're locked down. We cannot be going out. And then, of course, so ang gagawin na lang natin, so you can just have to do your parang aerobics or some dancing. Okay, so you can actually just, if you have your stationary bike, then you can just have that. Okay, so at least 30 minutes. Okay, wash your hands 20 seconds or more depending on the need. Okay, and keep up with your vaccines. So I know a lot of you have some skepticisms over vaccines, but then I tell you, it could help. It really will help. Okay, so maraming sinasabi na there are those who are saying outrageous things about vaccines, that they're going to be parang papatayin because of the vaccine. So please, hindi po. Okay, so keep up with your vaccines, and the best vaccine is the one that's available in your community. maintain a healthy weight, of course, by eating a very good diet and of course exercising, you have to maintain a healthy weight. Okay, so have your BMIs assessed and then of course your height for weight or weight for height rather. No smoking, please. At this point in time, definitely no. And even after the pandemics, please, okay, at least you've started, stop smoking. You started to stop or quit smoking. Try to minimize stress. Okay, it's important that you have to deal with your stress level, and then of course don't go beyond things that you cannot be really doing. So wala pong Superman or Superwoman sa atin. Okay? So that's how you will have to battle it out with your or how you will have to boost your immune system. But if you cannot really be just doing everything to boost it, okay, then we have immunomodulators. Ano po yung tinatawag na immunomodulators? These are substances that can help you support your immune function, modifying it in a beneficial way. And then, of course, the immune system responds to a threat. So meaning, okay, at the time of the threat or when you have the threat, these immune modulators will actually be the one to bombard, lambast all these microbes or yung mga viruses and the bacteria. So that's how the immunomodulator. So this is one of the property of our product presentation. So may antiviral, antibacterial na siya, tapos immunomodulator pa siya. Okay, so there are two types of immunomodulators. One is an immunostimulant and the other one is immunosuppressant. So we're not going to be talking about immunosuppressants because these are more for the anti-rejections. Okay, but here immunostimulants could be actually for the activation of your immune system. So it enhances your defense mechanism and it could be used in treating some of our dreaded diseases or problems like or illnesses like cancers and even infection. So that's how we are actually navigated by our immunomodulators towards immunostimulation. So it could induce the stimulation or amplification of the immune response, and it's known as immunostimulant or as immunosuppressant to actually enhance the efficacy of the vaccines. Okay, and then of course we have also rather an immunoadjuvant that would actually potentiate. Okay, and once you are vaccinated, okay, it will take some time before the antibodies could actually be heightened to protect you against the infection. So at the time that you are trying to have your best antibody after vaccination, it's okay and it's very good to have immunoadjuvants. So this will heighten or this will actually increase the efficacy of the vaccines that you have actually taken. No? So mas maganda po. And especially nowadays that we have variants kasi yung mga question nga po if whether this particular vaccine could be able to combat a certain variant, no variant D, yung Delta variant nga. So once you have this, okay, and then you have an immunomodulator that will back you up, meaning both the vaccines and immunomodulators, no, then you have a very good fight against all these infections or these variants. Okay, so usually these immunomodulators that we have, it's plant derived and then considered safer alternative. Kasi lahat ng mga synthetic po, lahat ko po sinasabi, no, they have actually a serious toxicity or side effects later on. No? So it's important that our immunomodulator is plant-derived, galing po sa halaman. Okay? And then of course, it's used for a lot of infections. And then of course, it's a natural product with immunomodularity activity. So they're used for autoimmune, yung minention ko kanina, inflammatory disorders, and even cancer. So they had a great interest in the last decade, and this is because it is inexpensive and less toxic to our system than as compared to synthetic. Now, we're down to and focusing, we're going to focus onto the product that we're going to be presenting to you. Okay, with all these viruses that has actually entered into our system, we have one way, or even before this could actually be entering into our system, we can already be preventive. And even if, okay, the viruses has already affected us, we can still be preventive in actually having it into progression. So, okay, I'm actually very ang tawag nito, uh, I'm trying to just say that we are not treating, no, in the sense that this is not the empiric drug for the virus or the SARS-CoV-2, but then of course this could be eradicating, preventing its inoculation, its attachment, or entering the body further down into our system. Okay? So, yun po, no? Para klaro tayo. Okay, and then of course, we are not in the claim that we are treating SARS-CoV-2 and all the viruses, but then it is preventing the microbes, these microbes, from getting into our system and from having, okay, its havoc and also its catastrophic or lethal effects. Now, this is our product that has all the very good ingredients. Okay, so if I may just say, I'm sure all of you knows most of, if not all, no, all the ingredients. Who would not know of ginger, luya, turmeric, luyang dilaw, oregano, and then of course, well, of course, you use this for your cough and all that. Okay, some of your poultice or concoctions or yung mga ano ba yung tawag niya sa Tagalog, yung mga haplas-haplas, okay? And then thyme, okay, you use this for your spaghetti. And then of course, you have your cinnamon, you have your sage, your basil, you have ravensara, your frankincense, your peppermint, and clove. So these are the active ingredients. Well, of course, it's mixed and blended with a bit of the honey to make it actually more palatable, though this is not a concern. Well, most of the diabetics are concerned if whether it's too sweet, but then it's not too sweet that, you know, your glycemic index will not be going high, no? So okay po siya sa mga diabetics, and then of course, wala pong problema siya, hindi siya masyadong matamis. Okay, so having said all those active ingredients, okay, so if I will have to be looking into something, and since I'm a botanist, no, sasabi ko po, I know all the properties, the chemicals inside all these plants. No, but then of course, I'd like to see also the you know, the significance of all these things, right? Okay, and even before, when I actually tried to read into some of the histories, and of course that these were actually already being used way back even before Christ, no? So yung tatlo dito sa mga ingredients natin, of course, were already mentioned in the Bible, even in the Old Testament. So like frankincense, cinnamon, the hyssop. Now it's actually known as the oregano, and plus some others that were actually constant also in the Bible. So there are 33 specific essential oils produced, and then they're mentioned in the Bible. And incense or frankincense is mentioned 68 times in the scriptures, such as in Psalms, in Proverbs, Isaiah, and Hebrews. For those of you who might want to read if whether, okay, you know, to see the veracity of my statement that it actually is there, just read on the Bible. Okay, so frankincense, let's go for first frankincense. It's the king of the oils. So anywhere you actually look into, okay, what is frankincense? It's the king of all the oils, and it's actually equated to the gifts that were actually given during the birth of Jesus Christ, di ba? Meron yung frankincense, gold, and myrrh, right? Okay, these three were the gifts, okay, of the three wise men. And then of course, it's actually very important, no? So may significance po siya, kaya po siya irinigalo, no? And then of course, this is how it looks. This is a resin of the frankincense. As I have told in my stories that, okay, the frankincense is really good, and I've tried it when I went to Greece, and then of course it has really made me in awe in its potentials to be treating, okay? And then of course, this particular frankincense is actually processed in steam distillation. So, and then of course it contains alpha philandrines, alpha-2-gene, alpha-pinene. Okay, so properties of this frankincense, it's immunostimulant. As I have said, it stimulates your immune system. It has anti-inflammatory, meaning for the inflammatory cells. Like, okay, also when say you have cytokine storm, which is an inflammation reaction when you have SARS-CoV-2, ito po yung nakakatakot sa mga lahat ng mga may SARS-CoV-2 or COVID-19. That is at the time when 9th day or 11th day that you have a surge of your cytokines that's causing a lot of death. No, ito po yan. So ito po yun. It has the property anti-inflammatory, preventing the cytokine storm. Okay, anti-cancer. So this is also prevention of your cancer cells after it's being stimulated. Kasi we all have cancer cells in our body waiting to be stimulated depending on our vices and our exposures. If you're a smoker, then you can run into lung cancer, which is actually very, very fast in its deterioration. So, lahat po yan. Hindi yun. Nagsismoke ka and then you're actually buga ka ng buga and somebody else is actually inhaling your fumes. Then also that person, even if he or she is not smoking, then she can run into the disease of having lung cancer. So, antidepressant, of course, as we all know, when we are all sick, there's a depression. Okay, so that comes in, okay, because of our hormones are actually going down way too low. Okay, so then we go into depression and restorative. Wala naman po kasi, let me just tell you that wala pong nagkakasakit na tuwan-tuwa. Of course, there's depression. Restorative, the way it restores your body into your completeness, into your whole totality of being. So basically, so these are the top properties that you will be hearing in a lot of these active ingredients later on. So basically, ito yung mga top properties. They're just so common in all this. So they're all lumped together because of their synergistic and of course some additive effect. No, synergistic magkakapareho and then of course mabisa siya para nagtutulong-tulong sila para sa pagpuksa ng mga sakit, okay, or mga simptoma. Okay, so ginagamit po siya sa ating mga immune system, sa mga autoimmune disorders, and then of course congestion and then of course cough, allergies, and seizures and tumors. Now, the second one that has also gained its importance and it's always a constant in the Bible is the cinnamon. Okay, akala ko yung cinnamon yung pagkain lang talaga na okay binibili kong tinapay, no? But of course, it has actually significant importance, and then, of course, it was actually stated in Proverbs, and then of course in some other well, of course, it has a very good scent, a scent rather, that it can be used for some perfumes and cologne. Okay, this is how it looks. Okay, for a cinnamon bark. Okay, and then of course it's actually containing the cinnamaldehyde and eugenol and phenol. Okay, so what are these for? So the top properties, it has antiviral, antifungal, antimicrobes, and then they can be used for actually cleaning your wounds or actually cleaning or prepping your to prevent the microbes, no? So antiseptic, no? So parang mga Clorox, Sonrox, or mga ganon. Or Chitacepsi, for example. Okay, antioxidant and aphrodisiac. Okay, so this is used for colds or flu. Colds and flu, they're actually not the same. No, yung cold, usually they're sneezing. So bahin ka ng bahin, you're having a stuffy nose or congested nose, and then of course you have a sore throat, and then you may cough. No, so that's the cold. But then of course, if it is actually tawag nito, if you have fever, headache, chills, fatigues, and weakness, then you have the flu. Okay, so cinnamon can be used for both the colds and the flu, and then prevention of it. Then muscle aches and pain, oral health, fungus, and bacteria. So high salt and or now we call that in a more parang constant way of using it. It's not high salt anymore. It's oregano. So in the Old Testament, it is actually being used for ceremonial cleansing. So it's actually used in offering the vinegar, the wine vinegar, on a sponge using the high salt bark or stalk. Okay, so it was actually said in Psalms, and then of course, and it's actually for purification or purging or cleansing. And then of course, you may also find this in Exodus, then Leviticus. You may find it also in Numbers, and then of course in Hebrew, as well as in John. Okay, well, of course, it's now known as the Origanum vulgare, or the wild oregano, as it was used to be known as the hyssop or ezom. Okay, so that's actually the history of that hyssop. It's really very, very useful during the olden times and up to now. Okay, so it was widely used for some lung conditions, including asthma, pneumonia, bronchitis, sinusitis, and cough. Okay, so this is how it looks. Okay, so oregano is actually very beautiful, and then it's actually containing carbapenem. Okay, it's antiviral, antibacterial, and then antifungal. It's also used for parasites. If you may have, okay, some helminths or yung mga ascaris, yung mga ano bang tawag, bulati, okay, then you can just have, okay, this particular oregano that will eradicate it. Okay, some that have actually used our product, also they felt that they had also some eradications of parasites in their body, especially for those who are actually constantly eating mga sashimi or sushi. Okay, so then of course, then you can actually have this to help you out with your parasites. Okay, and then of course, for those that are antibiotic resistant bacteria, okay, so oregano is also there, has that property. So it's used for some of these infections, okay, so tonsillitis, strep throat, and then methicillin-resistant Staphylococcus aureus infections, pneumonia, TB, warts, canker, and sore. Of course, I have cases that, you know, of course, they would put it in the those ulcer or yung mga singaw, and then of course, then the day after too, okay, they already healed. Okay, so it's good for some oral mucosa problems. Okay, then we have basil. Okay, so it is actually very good. Well, of course, basil is the one you use for in your in cooking. Okay, so it contains linalool, and then I have your methylcavicol and eugenol. Okay, so it has the same properties as mentioned in the others. Okay, so they have antibacterial, anti-inflammatory, antispasmodic, regenerative, and steroidal. Okay, it actually is a very good alternative to some of those that are actually looking for some antibiotics. No, so it's steroidal, and then neurotonic. It tones in your nerves. It actually calms your nerves, and then a stimulant, and also good for digestion. So for those who are having some problems with anosmia or loss of sense of smell, and due to, say, for example, you have an affectation of that when you had the acquisition of the virus, and then of course your nerve has been affected. So this could be a good one to eradicate or to actually remedy that particular anosmia, or that you can have these basil to help you out with that. Okay, but there's caution to use of it for especially those who are pregnant. Okay, then the clove, it has eugenol. It is for all those properties mentioned. The one thing that is different is that it also is regenerative. Okay, so it regenerates your cells and all that. It's also nervine. There's a very good aura property that it actually is a powerful antioxidant. So when we have antioxidant, it eradicates your potential to becoming sick, and then of course your cells to die or have, okay, apoptotic cell death, no, yung tinatawag namin programmed cell death, no. And then of course we have antioxidant property because this will eradicate also parang ano to, free radical scavenging, no. So lahat ng mga exposed sa mga free radicals from the radiation, from the x-ray, say for example, because you had, okay, your x-ray done recently, and then of course not only from the x-rays but also from the radiations of your cell phones, from the laptop, okay, from the iPods, and also the hair dryer, your oven, your microwave oven, lahat po yan meron po mga radiations, and that could actually prevent you by having the antioxidant property of clove. Then of course it's an immune booster for both the viruses and colds, infections, and also of parasites. So ginger, of course, who would not know of ginger, no? So unless, okay, ikaw yung ayaw kumain ito, but then still, that ginger is there in our cooking. So it contains alpha zingiberine. Okay, it is used for the congestant, no? So you may mga fluid-filled inflammatory cells like, okay, sa inyong mga sinusitis, and you can have that, okay, and also for some of your mga rheumatic pains, yung mga rheumatoid arthritis ng ating mga lola at lola, so they apply it, okay, nagahaplas sila. And then of course, analgesic, and that's a pain reliever. Antispasmodic, okay, and then also as a stimulant and a laxative, digestive stimulant, neurotonic, okay, so these are some of the properties of your ginger or your luya. Then peppermint, okay, it is menthol, alpha-pinene, and then of course beta-pinene and menthol acetate. So almost is the same. And then of course, one thing is that it's used as an expectorant. So when you have, okay, some of the symptoms that you are actually trying to eradicate, then you can use all these to expectorate all the phlegm. No? So ito po yung property ng peppermint. Okay? And it also has analgesic properties for pain, of course, and then also stimulating. And then, of course, it can be used in a lot of aches and pains, so allergies, hives, migraines, asthma, sinusitis, also for the loss of sense of smell, and then, of course, muscle tension pain. Ravensara is contains the alpha-pinene and cineol, and then also the same. But then one thing is that it also is an expectorant, no? It expectorates or expels your phlegm, okay? And then, of course, it's used for chills, flu, whooping cough, okay, which is a dry cough. And then, of course, if you have that, normally we see that in these particular cases of SARS-CoV-2, then you might just be able to be remedied by this, okay, or you alleviated rather, okay, alleviated by this through the use of Ravensara, okay. And then, of course, all the same properties. It has the antiseptic, viral, bacterial, fungal, anti-inflammatory, antioxidant, tonic, and stimulant. Okay, sage. Okay, it contains your cineol and camphor. It's antifungal. So it's actually best used for as an antioxidant, disinfectant, anti-inflammatory, and then of course bronchodilatory activity, meaning it opens your respiratory tract, okay, your lungs, okay, so be able to breathe, what's this, to have more air inside your lungs. Your thyme, okay, is actually containing your thymol and terpinine, okay, so they have mucolytic properties. So one good thing is also it has it's able to lyse or to liquefy your mucus and then be able to be expectorated by this, no? So pwede niyang i-expel yung inyong liquefied na phlegm or mucus secretions, okay? So it's used for colds and flu, viruses, asthma, croup, pneumonia, candida, or this is a virus, and then of course some painful sores and muscle sores. Turmeric or the curcuma longa is actually the luyang dilaw. It has turmeric, okay? It is antiviral, anti-bac, antioxidant, so everything that we mentioned, but one thing is it's actually good for cancer, so anti-carcinogenic, so anti-mutagenic, and anti-tumoral. So this is actually one that is very helpful in preventing us from getting the cancer that we get from, okay, the stimulants that we have, from the vices and free radicals that we have, okay? It also is used for detoxification and decongestion, say, for example, in the liver. So it's really good for decongesting the liver and detoxifying the liver. So mentioned were also the same properties or uses just like the others, okay, but then of course it has very good effect on some of your autoimmune disorders and also muscle aches and pains, okay, so apart from the respiratory issues. Now let's have a synthesis of how this is going to actually affect or actually help us eradicate a particular viral infection. So basically, all our viruses would have the same route of entry. The portal is actually at the nares, and then of course once it goes into the nasopharynx, sa nasopharynx po natin marami pong cells yan. So di ba po, ang bawat lahat ng organ systems natin may mga cells. Okay, we have billions of cells. Okay, so once this is your, okay, this is just a representation of your cell. This, the one that is in lilac color is your cell. Okay, this is just one cell, no po? Okay, and then of course, with inside the cell, you have a lot of organellar structures. Yung mga inaral po natin yung elementary, yung high school, okay, and even college, no? Okay, so this is the one outside. The white is the outside of our cell. So this structure here, the one that is spiked and also very beautiful, is known as your virus. And now for this, it's actually the coronavirus. They see that you have a doorknob here outside of our cell. This is the receptor site na tinatawag. Okay, it's the ACE2 mediated binding of the virus with the spike and the receptor. Okay, so even at the entry, nasa, say for example, nasa nasopharynx pa lang si virus na nasinghot mo, okay, and or na inhale mo dahil may bumahing or may nagsalita or mayroong umubo, then you may have, okay, the autoimmune acting already with its active ingredient oregano, no, here at the onset pa lang. So pagpasok pa lang or even parang bago pa siya pumasok, no, sa ating cell. So it acts from the outside of the cell up until it gets into the cell. And then of course, together with the ginger, once it has entered rather, yung ginger mo and your cinnamon can also play a parang a synergistic effect that would try to eradicate the virus, no? So once it underwent endocytosis, ito na po siya. Okay, pumasok siya, nakapasok siya dahil naprotektahan siya ng, okay, in the form of an endosome. It will try to open up later on to reveal or to actually extract or remove from its own body yung lahat ng kanyang mga genetic material kanina nung sinasabi ko ng mga RNA. So there will be viral RNA release until this viral RNA would have these ribosomes that would actually be going into these particular area where you have the translation of all these RNA to your RNA-dependent polymerase. No, medyo technical ako, pasensya na po. No, medyo dito lang po magre-replicate siya. Okay, until it will have to be going into further translation, and then it will actually assemble in the Golgi body, and then it will actually be going out as another virus rather, and then it will try to, once it actually is being released, exocytosed by the cell, no po, no, pwede na po siya maminsala na naman ng iba pang cell. So papatayin niya ang ating cell na ito and then release, and then of course attack another cell. Okay, so and some others would also, once it actually has entered, gain entry, and it actually has released all the viral RNA. So the peppermint, the turmeric will try to eradicate it and try to combat the viruses, the viral RNA, and prevent it from going into some replications later on. So kasi kailangan po nito, yung mga viral RNA are needed for it to actually be translated to become, okay, a component in the replication. Of course, you have the sage, you have the basil, you have the clove that would actually prevent the replication here. And then once, okay, say for example, medyo talagang matindi ang kanyang virus, no? And it has actually furthered on in its replication, no? Pwedeng yung frankincense will actually prevent it from being released, no? So hindi niya i-release yung virus na panibago. So that's how it looks in and out of the cell. So depending on, well, of course, on how how fast you have actually determined that you already have some exposure, and even before you could have the manifestations of the signs and symptoms. So yun tinatawag natin incubation period po. Ano po? So yan po, yung time yung peppermint would also be, well, basically I've mentioned that already. So the peppermint will immediately fight the virus or kill the virus outrightly, no? So just in summary, for a better understanding, kasi medyo alam ko there's so many structures in that area. Okay, so the oregano, your cinnamon, your thyme, and ginger, even before the viruses gets into our cell or attach into our cell, it's acted upon by these four. Then once it gets inside the cell, okay, the particular active ingredients like your peppermint, your turmeric, your basil rather, your sage, and your clove, this would act upon the virus and try to eradicate or kill it. Okay, and then of course the prevention of its release is through frankincense. Okay, so it will definitely prevent the release of a new virus, meaning from yung play of all these active ingredients, so definitely walang makakalabas na virus na magre-replicate sa ating host cell. Okay, so basically the same as into the structures of the bacteria. So they all have its particular functions in every bacterial cell. And then, of course, preventing, okay, and its affectation and proliferation inside our cells. Okay, so our immunomodulatory and antioxidant properties are all embedded or actually incorporated into this particular bottle at 50 ml. So it's immunomodulating, and then it's anti-inflammatory and antioxidant. Okay, and then of course, apart from those mentioned, it has immune boosting and then also antiviral and antibacterial, anti-tumor as well. So all lumped into just one bottle, 50 ml. It's a good dose of prevention, and it's a good way of actually making our immune cells also functioning well. No? So, and then preventing us from having infections and inflammation, and even oxidation of our cells and having tumor later on. So how do we take it? Okay, at least for prevention, this is actually our claim. It's actually good for prevention before we could have the disease. You take it an ml 3 times a day. So take it when you need to go out and to face the world. No, definitely, even before you can be going out. Okay, so especially we're now locked down. Okay, so when you have to be going and buying for something, no, or kung hindi naman, meron naman tayong mga over, what's that? Yung, well, we have crab and panda, di ba? You can actually, even before, you can actually go out of your gate, okay, to claim your food, and you have to also do some autoimmune. Okay, so basically you have to take it whenever you need to go out or whenever you have to go home, so preventing you from having the disease acquisition, and then also preventing your family from also getting the infection. So protect yourself before you could be protecting your family. So for my recommendations on the dosage, okay, so preventive and promotive, protective. So they're all just this, terms that are used interchangeably. Or in our terms, we use it prophylactically. So 1 ml of a dropper 3 times daily before meals. But if you turn asymptomatic, okay, so I mean, you're positive COVID, and then of course asymptomatic, then you can also be going for an ml every hour for 8 hours. Then of course, thereafter you can resume it with our 3 times daily. So loading dose ko lang yung, okay, this is just my recommendation. The loading dose is an ml dropper of a dropper every hour for 8 hours, so that you won't have a progression of your symptom. Wala ka nga symptom asymptomatic ka, pero COVID positive ka. Yeah? Okay, so it prevent you from having, okay, the progression from an asymptomatic to a mild, or from a mild to a moderate. Okay, so but if you have a mild symptoms already, say you have a fever, you have a cough, any of those, okay, symptoms that you are expecting to look, you're expecting for in a COVID case, no, you can actually have an ml of a dropper for 12 hours, then every 4 hours after the 12th hour. Okay, so, but of course, it's important that you would have to seek consult with a doctor, especially for those who are already having symptoms, no? Or say, for example, when you have been like diagnosed positive for RT-PCR, okay, RT-PCR po is the confirmatory for the COVID, no? And then, of course, you have to um, see or consult a doctor. There's teleconsultation, but if you cannot access teleconsultation, and then of course, sa totoo lang po, dun sa Viber group ko for some doctor friends and all that, nakakatakot po kasi talagang even doctors are having a hard time finding hospitals po para sa kanilang mga kamag-anak, even themselves to be accommodated in the hospital. Wala na po kasing hospital na nag-a-accommodate. Wala na po, halos sarado na po lahat ng mga ospital, punong-puno po. So, but then of course, if you would be needing, okay, just like what I did, sabi kong gana, I don't think there will be any overdosaging on this, okay? I try to actually have myself, have myself a tablespoon of that 3 times to eradicate my onset, my symptoms at the onset rather. So, it really helped me. So, just of course, you have to make sure that you will have to be monitoring the signs and symptoms. Fever, you have to also do some supportive treatment if it's too high, no, usually. But of course, if it's not really that too high, okay, kasi may mga antipyretic property po itong ating autoimmune. So this can really eradicate the fever and all that. So, but then, of course, should it go higher, then you can actually be supportive with having to treat for the antipyretic. And then, of course, hydration is important when you have this. Unless you are congested, no, medyo parang fluid-filled na yung lungs, then you might just have to actually really be going for the hospital. Okay, so if and when you have cases or patients or relatives that are having some difficulty of breathing, so merong signs of like pursed lips, no, talagang humihinga na lang sa bibig, no, halimbawa po yung medyo talagang hinahabol niya yung paghinga, or nagsasalita at nahihirapang huminga, or talagang medyo yung kanyang dibdib ay talagang tumataas, no, these are the signs that you are really that you need to really be bringing the patient to the hospital. Or may cyanosis of the lips, no, yun medyo talagang kailangan po talaga ng oxygenation yan. Okay, so we don't say that okay, inumin mo lang ito na then mawawala yan. Of course, these are severe cases already. So just to say that when you have a severe case, okay, it definitely will not have to wait for long until the patient would have to be ventilated or oxygenated or actually attended to in the hospital. But the problem is, will there be a hospital would be willing to accommodate? So that's another question. So prevention is more important in all these things. So even before we can go into the severity, let's all be preventive. So let's all be doing our part in eradicating the viruses. And at the same time, let's all be precautionary, meaning we have to do all our precautionary measures and do what we're supposed to do. And one thing more is that, of course, the number one thing that we have to do is pray. Pray at this particular time. And especially we have to be caring for a lot of people. Then of course, I am seeing a lot of people. I mean, like members of this company that they're actually doing their way of actually inching or trying to actually extend help. No, natutuwa ako. So nakikita ko yon. So please do what you're supposed to do as a caretaker, caregiver, or health provider or health advocates. Now, please we are all needed, but of course you have to protect yourself even before you could be helping others. Yun lang po. That's my word with this lecture. Okay, so thank you very much for listening, and I hope that you have learned from my lecture.
Thank you so much, Doc. Thank you po. Ayan, so I think we're ready na po to entertain questions, no, Doc?
Opo, sige po. Okay.
Ayan, thank you po. And so if you have your questions for clarifications regarding sa discussions natin sa ALTAIMUNE, you can chat po sa ating chat box. Ayan, so para basahin na lang po natin siya isa-isa. And may address natin po agad kay Doc James. And we have po our first questions galing kay Sir Dennis Masula. I introduced this ALTAIMUNE in Canada for immune booster, vitamins, and other health concerns. My client asked me if we may provide them a prescription from a physician. Do we do that po, Doc James? Thank you po.
Actually, okay, let me just have this as well, of course, there are other standards, say for example, like in Canada, so they would actually be really looking for that, especially when you're ordering it in volume. But normally, if it's just a supplement on a normal volume, okay, so definitely hindi naman na kailangan. Sometimes it's just over the counter, or say mga supplements like yung mga multivitamins that we have, hindi na kailangan po. We don't really provide that since it's a supplement. But then of course, there are standards like in Canada, in some European countries, they would really be looking for prescription that states that these are what, okay, the supplements. And then of course, well, usually kasi pag volume talaga, they would really be requiring also. So I have had, okay, some patients that are actually getting some supplements, okay, like this, okay, hindi naman sila hinihingaan ng mga prescriptions. No, normally we don't. It's a supplement. It's a food supplement actually.
Thank you so much, Doc. Ito po, pwede daw po bang ALTAIMUNE from 6 to 13 years old?
That has long been asked, and then of course, we don't really have the answers yet, rather, since there wasn't any trial having this particular age group, no? And then of course, hindi ko sinasabi na, of course, it's going to be dangerous, no? Kaya lang po kasi wala pa kasi talagang standard trial or clinical trial for this particular age bracket. So, but because these are active ingredients naman po, these active ingredients naman po are normally found in our, daily cooking, no? So I don't think it will be really that deleterious or dangerous. But then of course, as I am telling you, it's your discretion. But then of course, we don't really promote it in this age bracket, especially for those with some epileptic or mga seizure attacks. Okay, so especially in this age bracket. So I don't know if I would have to say that you have to ask your pedia, but then of course wala kasing walang well, if and when there will be some go signal, say for example, from the one who actually did the invention, okay, or this particular blending, okay, I think that's a time where we're going to say that it could be extended up to certain age bracket. So wala pa po kasing trial sila na talaga it was actually being used by this particular age bracket for a certain problem. So yeah, that's actually my honest saying or my honest answer to that. Wala po kasi sila. And even during the time when they have been asked, wala po sila talaga kasing go signal for the young ones, or it's actually being used for 18 and above. Mm-hmm.
Thank you so much for that, Doc. This questions po is galing kay Miss Abby. So her dad daw po have COPD. Is this okay for him po, and same dosage din daw po ba ang iinumin?
Yeah, for COPD, yeah, you can actually, wala naman ako nakikita na that would be contraindicated to actually be giving to COPD cases. Okay, but then of course, how severe is the COPD, and then what actually, well, usually meron sila mga empiric drugs for empiric drugs for the COPD case. But then, of course, I just want to know kung ano yung what do you want to address in the COPD case? Okay, meaning, okay, could this be the one actually eradicating the COPD? It's not. No po. May empiric drug po na binibigay po sa mga COPD cases. Oo. Pero it's, well, of course, to actually boost the immune system of COPD case, yes, it could be helpful. So that is actually to prevent also some infections later on, since this is this could later be an immunocompromised state ng COPD, then you can actually be helping the patient by having the boosting of the immune system for patients like COPD case. But not to eradicate COPD in the sense that, it's already been there.
Okay, Doc. Thank you po. Ito po, another question, because sabi po ni Sir Dennis, in some cases po, after taking AltaImmune, they experience po rashes on skin. So, ano daw po yung masasabi niyo po dito, Doc?
I don't think that is actually the, parang can be attributed
The
to
reason,
attributed to the intake of AltaImmune. So rashes, it's the first time that I'm hearing rashes because it has antihistaminic property. So it's actually being used by some, okay, for the further allergic reactions. I actually have a lot of allergic reactions then, of course. Okay, this is the one actually that I'm using to address all that. So it has antihistamine. I don't think that will be actually, well, active ingredient there that would cause some rashes. I cannot recall at this point kung meron man. If ever, okay, what you should do if you have a rash or any of this allergic reaction, stop the intake of the autoimmune and try to have it like, okay, for 2 to 3 days or even a week. After a week, then that's the time then you can resume if you may need to resume and try to see if the one that's causing the rashes is coming from the autoimmune. As long as you have the a period that you have stopped, okay, and then of course, and then try to see if it will lyse or mawawala po yung rashes. And then after like 1 week na nawala, na resolving rashes, okay, then you will have to, if you may need to observe if whether it's caused by the autoimmune. Kasi kung manunumbalik after nag-resume ka ng autoimmune, okay, manunumbalik yung rashes, then of course, it's not for you. But never po ako nakarinig pa ng rashes that they're usual. As you mentioned, usually nagkaka-rashes. So, okay, if that is usually causing you rashes, then you have to stop it. It's not for you.
Yes, parang first time lang din po ako naka-encounter ng ganun, Doc. Parang first time to hear po this kind of situation. Ito po ay next questions. Kung meron daw po bang iniinom na mga gamot, pwede daw po bang isabay ang autoimmune?
Okay. Depende kasi I cannot answer for the generalized medication. So depende po dun sa mga medications na iniinom. But of course, in some, yes, of course, wala naman po dito yun na it's not something like an anticoagulant o wala mga ganon. So, of course, you can actually use for, the only thing that I know, yung mga hypertensives, that those that are diabetic and also those that I mentioned, yung mga diseases or disorders kanina, you can actually be taking it with your medication. So, wala naman po siyang contraindications, no? Or nothing that would actually, or say, for example, kagaya ng mga, well, normally po, magsa-surgery ka, lahat po ng mga herbals or anything that you would have to, anything that you're taking as herbals are actually stopped at least 2 weeks before any surgery. Yun lang po yung pagkakaalam po dito. Pero of course, in others, no, so kung sabayan sa ibang medications, of course, if you're really fearful that you might just have some parang contra ang tawag nito or drug interactions, then of course you will have to actually take it parang at parang a space time, meaning okay, after an hour, say for example, then you can take the medications if need be, or usually kasi before meals natin di ba? Okay, if you will be needing some medications that you would have to be taking before meals also, then you might just have to space it apart at least 30 minutes to an hour. If you will be needing, okay, the autoimmune earlier, then you can actually have it earlier so that you can have, okay, a medication. Basta you space it apart lang po para hindi po kayo mag-worry that, it will have a drug interaction.
Thank you so much for that, Doc. Doc, this question po is galing kay Miss Yeldita Ramos from New York. So question to sa mga nanonood po sa atin sa FB Live. So pag person daw po nagda-dialysis ng 3 times a week, hindi na din po siya makaihi. Makakatulong po ba itong autoimmune to boost her immune system? Kidney is already damaged po.
Okay, so you have two different doon, no? Maraming concerns diyan. Okay, so hindi na siya nakakaihi definitely kung 3 times a week siya nagda-dialysis. It has to be increased kasi talagang well, of course, the renal functioning is not really good anymore. No, so of course, will it actually be helpful in the renal failure? Hindi. So hindi naman siya para sa kidney failure. So but then of course, in boosting the immune system, yes, of course, and then prevention of some infections, yes, it could be. But then of course, it has to be really medyo yung kanyang nephrologist will have to do parang some reassessment of the number of dialysis, and then of course yes, kailangan po ang if and when need be, no, kailangan po ng renal transplant, say for example.
Thank you po, Doc. So, Doc, if the person daw po has a severe sinusitis, what is the dosage that the person will take po?
Okay, normally would actually, siguro ako, I would actually increase it to 2 drops, no? 2 drops per, 3 times a day pa rin. So 2, balik mga 6 drops in a day. Oo. So ganun. Severe. Oo.
Thank you, Doc.
Mm-mm.
Ayan. Ito po, pag po nagme-maintenance ka para sa hypertension at cholesterol po, pwede po bang mag-alta-immune?
Yes. Mm-mm. You can do that. Autoimmune is never a contraindication to hypertensive meds, anti-hypertensive meds.
Okay po. Noted on that, Doc. Ayan. So ito po. Hi, Doc. Thank you so much for sharing your knowledge to us. My question is, nowadays people need vitamins. Is it okay po to take vitamins D, B complex, and C while taking autoimmune? Need po ba bang mag-take ng vitamins?
Actually, there's wala naman po kasi talagang studies on the multivitamins and the use and the prevention of yung mga ating mga coronavirus or SARS-CoV-2, but then it could help, no? Of course, syempre, there's all what we call multivitamins, marami namang multivitamins. It does help, but there's no actually direct link to the prevention of it. No, wala po talagang studies. Pero well, if it could help, yes, of course, you can actually just have all the supplements that you could be taking, as long as you're able to fund or finance it. Kasi the question is if whether you cannot, and then of course, mamimili ka na lang, multivitamins ba or the autoimmune, say for example. So yun na kung ako, I would be ngayon kasi it's so difficult to actually really be able to pinpoint which one would actually be eradicating one or not. Okay, as long as you can get hold and then you're able to source it and fund it, okay, then you can actually take it. Ako, wala namang mawawala. So ako yung paniniwala ko dun. And there's nothing that you will lose if you're going to take it. Okay, so as long as you're being preventive, as long as that you're able to fund it, okay, then of course it's your system, it's your body that you can actually just go and take it. Okay, but then of course, as I said, okay, there's no direct study that this will actually eradicate or completely prevent you from the acquisition of the virus.
Thank you, Doc.
Okay.
Doc, ang autoimmune po ba natin ay pwede daw po sa mga patients with CKD?
Kidney disease, yes, okay, pwede naman. Kaya lang, of course, ito na nga yun, kasi I have a brother who's also a CKD patient. So, pero syempre, they don't want to, if like I would be talking to the nephrologist, okay, they would say that, hey, we're not going to allow any medications or any other supplements that would actually get in the way of our, syempre, they have their own training, they have their own specificities, they have their empiric drugs as well. So, patients are usually maintained on that particulars. Okay, so if you're going to add something that might not be able to be explained to them or that they cannot actually be, so yan, they will try to negate it. Sasabihin niya, wag na, hindi na muna. Okay. But of course, okay, in my brother, okay, in my case, I've tried him to actually be taking it. There's nothing really wrong with like, okay, giving it to him. But then of course, yun na nga lang. Sabi niya, gano'n, I'll have the medications first, my medications first. Thereafter, if need be, so then I can just go for that. Okay, so ayaw niya rin pong maging bias in the sense that, you know, or unfair to the doctors who are actually treating him. And then, of course, silently, I'm giving him some other thing. No? But then, of course, I've tried him. Then, of course, okay naman. Wala naman yung mga tipo mga untoward reactions to a CKD patient. Wala.
Thank you, Doc.
Okay.
Doc, about naman daw po yung sa na-stroke na tao na meron daw pong amnesia in the present?
So, dalawa yan, stroke or amnesia in the present. So actually, wala akong doon na directly would actually be preventing the progression of a stroke nor the amnesia to actually going back. Okay, it's actually the neuro department, and then of course the attending physician of that patient could be addressing those two. Pero if like, since this patient is immunocompromised state also, and probably debilitated pa siya, so nakahiga, or may mga residuals, no, it's also good to have preventive immunomodulators like this. But it will not be directly treating the stroke nor the amnesia. Opo.
Wow, thank you, Doc. Doc, I think this is our last question for this afternoon.
Okay.
So if a person daw po is taking autoimmune for 1 week, 3 times a day, 20 drops, then suddenly got a flu, ano po kayang reason?
Okay, got a flu. Well, of course, it's not actually, as I've said, even us, vaccinated could still be getting, the virus. Okay, and then of course, taking autoimmune altogether, still is not an absolute, not an absolute parang preventive measure, meaning hindi siya absolute guarantee that we're not going to be able to acquire it. No, so just like in some other talks that I actually did, so I said that the vaccines would be preventive in the sense that you would actually not be going into the severity of it. No, so hindi ka man, kumbaga, na-acquire mo man yung virus, just like my family right now. No, it might be too difficult for me to actually be accepting the fact that we got vaccinated, we're taking autoimmune, and then still we had the virus acquired, no? But then of course we just rely onto what has been said about, like, okay, you're not going into the severity of that. Okay, so yun na lang. So parang with autoimmune, okay, having that, okay, and still you had the flu, I know that it's not going to be too difficult or worrisome or too morbid to actually be contracting the flu. But it could be the one that is one. Okay, ito na rin. Isa pang major ito. Sabi ko, no amount of taking all these mga preventive immunomodulators if you are also violating yourself, meaning uminom ka nga ng autoimmune, but of course you're awake the whole night, okay, naka-Netflix ka, games and all that, wala kang tulog, you're stressed and all that, okay, so you have to moderate everything. So no amount of immunomodulators could boost your body if you are violating yourself. Kahit naman sino pwede ka magkasakit ka pa rin if you are not taking care of yourself. No? So it's not the only remedy or the only answer to prevention or to preventing all this flu, but then of course at least you have something that would help you not to go into the severest form of it. Yun lang pong take ko yan dyan. I hope that answers the question.
Good point daw po, Doc. And they're all saying thank you daw po.
Oy, thank you din po. Thank you, ha. Okay. I just hope and pray that everyone will be safe and saved. No, please.
Yes po.
Let's all continue to help people. And then, of course, I am really, what do you call this? I'm really convinced po, ako mismo na na-experience ko po ito. And then of
Yes.
course, I am really feeling na talagang lahat talaga kailangan meron ito. So yeah, please help people to help themselves.
Yes.
Oo. Thank you ha. Thank you rin
Thank
po
you,
sa
Doc.
lahat.
Thank you so
Oo.
much. Thank you po for patiently
And
answering all the questions, Doc. Maraming salamat
anytime.
po.
Thank you, Miss Kay.
Thank
Opo.
you po. Palakpakan naman po natin, Doc James Boado. Thank you so much po. Thank you po.
Thank you,
And
Doc.
Doc,
Maraming
Thank
salamat
you.
po, Doc.
Opo,
Thank
ingat-ingat
you,
po.
Doc.
Thank you, Doc. Thank you po. Salamat po.
Thank you po, Doc. Salamat po.
Thank
Salamat,
you,
Doc.
thank you po.
Nakarating dito sa
Walang ano po.
UAE ang explanation nyo.
Ay, opo, ingat po kayo dyan. Oo, mahal
Opo.
namin kayo lahat dyan, mga Pilipino. Diba bigla
Double vaccine na pero mga positive pa rin sa COVID kaya si ALTAIMUNE yun ang solusyon.
Yes.
Opo, sige, please help them. Oo, yung mga skeptics, let them actually be okay lang yan. Pero next time hanapin kayo, nahabulin kayo niyan.
Yes.
Yes.
Oo.
Thank you so much,
Yes
Doc.
po,
Yes
Doc.
po.
Ingat po,
Okay.
Doc.
Ingat. God
Thank
bless
you,
us
Doc.
all. Oo. Okay.
Thank you
Sige
po.
po.